Autism Layengnaba Clinic among Ngasi Department of Psychiatry, Regional Institute of Medical Science RIMS da Professor G. SUNIL Kumar SHARMA Director RIMS na HANGTOKKHRE Angang singbu autism dagi kanbada mating pangnabagi dama clinic hangdokkibaduda Dr. M. Dinesh Singh Director State Health Mission Manipur, Professor N. Sanjib Singh Medical Superintendent RIMS Hospital Imphal, Professor S. Gojendra Singh Head of the Department of Psychiatry RIMS, Dr. A. Sylvia Devi State Nodal Officer RBSK Manipur Amadi, Dr. N. Dayapati Devi Chief Medical Officer Imphal West Saruyaki nauna hangtoklaba clinic asi Monday dagina Friday fawa ayuki pung mapan dagi nungtil pung ama fawa hangani hari.
This inauguration reflects AIM's dedication to providing comprehensive, inclusive and accessible healthcare services for every child, especially those with developmental challenges such as autism spectrum disorder. Just to take the note of what our MSS said, some of our staff spend half their salary dealing with a child who is suffering from this type of condition. They have to go to different places, they have to manage occupational therapies and whatnot. So we have seen this number rising in recent times. I'm not very sure when I was a student here whether I come across this or not. But over the last maybe 10 years or maybe 15 years, we have seen this. And I have many colleagues, when I was working at Delhi, people will ask like, do you have any specialty of this kind at AIMS or something? So, and even they will come all the way from Manipur and Nepal, and they will be just going to a, or one of our child psychiatrists or maybe a neurologist. And it's not an instant treatment here. We can't give a paracetamol or some injection and stuff. So it's a lifelong thing, and you can just imagine how tough that will be for a family to support. And for that, I think early intervention remains one of the most important things. I'm very happy to be, in collaboration, or you can say we have the collaboration with District Early Intervention Center under the National Health Mission, RBSK. And Dinesh, Director NHM, has been very close to me and he has been always very supportive. So I take this opportunity to thank the entire team of the NHM and the RBSK for supporting us. That affects communication, behavior and social interaction. With increasing awareness and improved diagnostic methods, we now understand that early identification and timely intervention can make a profound difference in the lives of the children with autism. Early support can enhance communication skills, improve social functioning, and empower children to reach their fullest. Clinic marks a significant milestone at the RIMS Imphal, and also I can say for the entire Northeast and region. It will serve as a multidisciplinary center where pediatricians, psychiatrists, psychologists, speech therapists, occupational therapists and other allied health services will provide a comprehensive treatment to the patient or the children. This integrated approach is essential because child development is multifaceted and not a single discipline can address all the aspects of child's needs.